Hello and welcome. My name is Bassam Redwan. I have proudly served as the senior consultant for the Thoracic Surgery Clinic in Lünen for a duration of 6 years. For recurrent pleural effusions, we ultimately have several treatment options, as is often the case in medicine. One potential treatment option could involve performing several pleural punctures, and it is well established that patients frequently undergo multiple such procedures during their care. This situation poses a significant burden for the patients involved. This has to be stated. Even if performed exceptionally well and with excellent local anesthesia administered every time, it still remains a significant burden for the patients. This indicates that the option is not truly valid, and only a small number of patients would be willing to undergo a puncture procedure on a regular basis. Therefore, it is honestly a huge relief for us to know that there are special tunneled catheters available that carry very little risk of infection. With the introduction of the drainova ArgentiC, the infection risk is now even lower than before. This advancement allows patients, provided they are fit enough and have received the necessary training, to manage and drain the effusion themselves, significantly enhancing their autonomy and improving their overall treatment experience. It is truly a huge relief for us, and we have enough cases where, as I mentioned, recurrent effusions develop, and instead of saying, okay, come in for a pleural puncture every 2 weeks, a catheter is implanted, solving the problem for now. And we must also say that many people have some fear because there is a foreign body involved regarding quality of life, etc. But people maintain a completely normal quality of life and fully participate in life. In my opinion, this is indeed a highly beneficial measure, clearly much more advantageous than enduring repeated punctures, which can be quite uncomfortable and inconvenient. A very nice innovation from the company ewimed is the drainova ArgentiC catheter, which is silver-coated and provides additional infection protection. This is also recognized as one of the potential complications, as wound infections can occasionally develop, particularly in patients with compromised immune systems, such as those undergoing chemotherapy, because long-term drains are implanted in these individuals. And that's precisely why infections related to catheters can sometimes unexpectedly occur. With the advanced silver coating applied to the drainova ArgentiC, this infection rate is significantly reduced based on the initial data findings that we have observed. In our field of thoracic surgery, this situation is particularly intriguing, especially because in a complex condition like pleural empyema, we often encounter instances where the lungs do not fully re-expand. If the patients are unable to tolerate a major surgical operation because of their overall medical condition, then it is crucial to ensure that there is a continuous drainage of the pleural space to prevent complications and promote their well-being. And if a standard silicone catheter were to be implanted, it would only be a matter of time before a serious infection occurs. Thus, the drainova ArgentiC catheter provides us with a significant additional advantage, as it allows us to effectively assist such patients while minimizing the need for a more extensive surgical procedure, ultimately facilitating their safe and timely discharge from the hospital. If they recover effectively over time, a larger operation can always be conducted later on. However, for the initial treatment stage, this particular approach is certainly not a bad option for the patients who have been affected. Another advantage is that for every surgical setting, whether you are implanting on an outpatient basis in the operating theater or however you prefer to implant, there are different sets available so that now you don't have to waste so much material. In the sterile operating room, as we clearly see in our detailed implantation video, I have many surgical instruments ready. This means that I don't require an extensive amount of material in my set, and the company provides options that are specifically tailored to my individual needs, so that I only have the material I really need and don't have to throw anything away. Especially when sustainability is such an important topic, it is important that we don't waste as much material and only use what is really needed at this time. For us as implanting surgeons, one might think that our work is completely finished. The catheter is already securely in place, and that's all there is. In fact, it is indeed true that due to the exceptional and comprehensive care provided by the company, ewimed, patients receive such thorough attention that they become perfectly trained in how to handle the materials involved in their treatment and recovery processes effectively, either through the nursing service that manages the catheter or through family members or even the patients themselves. Using the catheter by yourself is truly truly that simple, and I observe firsthand just how well patients are cared for, as well as how quickly and efficiently everything is organized and managed. The entire process is designed to ensure comfort and ease for those in need of this type of medical assistance. Patients can always receive the essential materials they need through a quick and efficient service that ensures timely delivery. I remain very convinced of the high quality of the product and the exceptional care provided by the company and their entire team. I have personally been working with ewimed for 15 years. I implanted my first catheter at the University of Münster, marking one of my initial thoracic surgery procedures. So it's a long-standing relationship, I would say. What I truly appreciated during that time, as a young assistant doctor, was how meticulously organized the entire medical process actually is. From the moment we decide to use an ewimed catheter for a patient, it became clear that we would need to fill out the necessary form. Additionally, the customer service or patient service representatives consistently arrived on the day of discharge or, at the latest, by the following day to assist. We always received very positive feedback from patients that they were well taken care of. As dedicated doctors, it was extremely vital for us to use only high-quality materials in our practice. We hardly encountered any significant problems during our time working together, and if any issues did arise, the ewimed team was always present on site, and we were able to discuss them quickly and easily so that the problems were solved. This was always a very good process. That's why I've been a committed ewimed user for 15 years and will continue to be one, because for me the workflow is just very simple and frictionless.